The following is a presentation for The Rose Lee Show. The views and opinions expressed in this program are not necessarily those of the station. Good morning, I'm Rose Lee. This episode will focus on our public health procedures and protocols from healthcare providers who are working diligently to keep you and their staff safe. Because we're all in this together. And the importance of eradicating data mining in social media and respect for all persons to create an all-inclusive America. When we return. Floridians are ready to venture out of their homes and enjoy our beautiful state. As some COVID restrictions continue to be lifted as testing identifies more positive cases in Florida. Healthcare workers and other essential workers need to continue to follow the Centers for Disease Control and Prevention guidelines of social distancing, thorough hand washing, and wearing a cloth face cover in public. But determining what safeguards are right for you is a question we should discuss with our doctor. Joining us this morning to discuss what precautions is right for you is Dr. Audrey Beria, a physician at WellMed, a part of Optimum. Good morning, Dr. Beria.
Good morning.
It's important for everyone to realize we all have specific healthcare needs. So how will we know if lifting COVID-19 restrictions is right for us?
Well, as it comes to older adults, we know that we're not all created equal. So therefore, anybody with chronic medical conditions should be very cautious and not to let their guards down. And have that conversation with your doctor as to when would be a good time for you to lift those precautions.
Here in South Florida, some people are wearing masks and gloves, but some people aren't even wearing masks. And we've heard from healthcare providers that gloves may not stop spreading germs. Hand washing for 20 seconds is the best option. So how do we determine if we may be at greater risk?
The thing that I tell my patients is that anybody with chronic medical conditions, such as diabetes, heart disease, chronic emphysema, or asthma, are at a higher risk for getting severe illnesses from COVID-19. Therefore, you should definitely continue with the precautions. And anybody who's older than 60 is also at a higher risk. So definitely continue those precautions and have that conversation with your doctor as to when would be a good time for me to be a little bit more lax on these precautions.
We keep hearing if you're older, you're at greater risk. But not everyone is cautious. Mostly younger adults who are catching COVID, who continue to socialize. So everyone should be cautious, correct?
Correct. And we're all in this together. So taking care of each other, I think, is paramount.
So if you are in a greater risk category, what precautions should you take as restrictions continue to be loosened?
First and foremost, don't let your guard down and make sure that you're keeping your doctor's appointments and answer the phone calls that your doctor's office might be making to you, because what we're trying to do is do a welfare check on you and make sure you're okay. Also, another type of appointment that WellMed offers is a telemedicine appointment. So therefore, you might not even have to leave your home to have that doctor visit. Practice good hand hygiene, which means 20 seconds minimum of hand washing. Wear a protective mask, be it cloth or a surgical mask or whatever kind of mask that you can wear, which was going to protect you. And also technology. Make sure you're staying in contact with your loved ones via Facebook, FaceTime, texting, what other means of technology that you may have.
I have friends who miss their family and friends and want to see if everyone is safe and let them know that they're being missed and loved. So how do we get this working? One way is doing a drive-by. This way we have to see people visually, face to face, but a little bit separated. And I think it's a great way to do a drive-by, pull up to the driveway. Your loved ones can stand 6 to 8 feet away and carry on a conversation. because we miss that interconnection of human beings, and mostly those we love.
Absolutely. It's very important in these stressful times.
When should a patient contact their doctor to discuss their illness and specific issues so that they can have the best medical advice?
Anytime you have any concerns whatsoever is a good time to call your doctor. If you're not feeling well, call your doctor. You have questions, call your doctor. And WellMed actually has a 24/7 nurse hotline set up as well at 866-469-3897, where you can get a live person and have any of your questions answered.
All right, so we have telemedicine, live questions answered, technology, health, through wellmed.healthcare.com. All you have to do is to call your office to schedule the type of visit so that you feel most comfortable with this form of technology. Or if you want to see face-to-face the doctor.
wellmedhealthcare.com. It's a great resource, and the nurse hotline phone numbers on that website as well. And you can also make a telemedicine visit with your WellMed provider.
Thank you, Dr. Beria, for joining us this morning to discuss what precautions are right for us that we can then go forward as these restrictions are lifted, determined on the basis of our own health care needs. Stay safe.
Thank you.
Physician practices who manage patients during the COVID-19 pandemic are confronting new, unique operational business challenges. It's more important than ever for health systems and healthcare organizations to create and ensure an infrastructure to provide support resources to retain physicians, nurses, and healthcare staff. Joining us this morning is Joseph DeCapua, President of Advanced Medical Consultants, to share Center for Disease Control protocols and procedures that his staff implemented to prepare primary care practices in Margate and Sunrise, Florida, to remain open and serve their patients. Good morning, Joseph.
Good morning, Rosalie.
Healthcare in America continues to face an unexplored setting in an attempt to drastically restructure change in healthcare offices to keep patients and staff safe. So did your primary care offices close down during the lockdown period, although they were considered essential?
Correct. The medical practices are considered essential. No, we evaluated all our alternatives, decided to keep the medical practices open. We were short a provider because one of our providers tested positive for the COVID-19. We had to clean the office as per CDC requirements. We then identified staff that were exposed to the provider and had them tested and sent home for 14 days. The good news, all came back negative.
Did these practices implement COVID-19 protocols and procedures for patients to safely make an appointment?
Yes, using CDC guidelines, protocols were developed and implemented. First, when a patient is making an appointment, we ask if patient has a fever and a cough to minimize chances for exposure to staff and other patients. They have the following options. Telephonic screening, example where we ask if patient has COVID symptoms and offer options of a telemedicine appointment with one of our providers, or if they prefer, contact CDC or their insurance directly to receive assistance on how they should proceed. If the patient has no symptoms, they schedule an exam, and when they arrive, the medical assistant takes their temperature, and if the patient has a fever and cough, we refer them to the local emergency room. It should be noted that we do offer to the patient that when they come, they could stay in their car, and we would call them when it's their appointment time to come in and brought directly to the exam room assigned to them. If the patient has any symptoms of respiratory infection, the following precautions are taken by the staff to avoid spread of illness. During the appointment call, we inform the patient to wear a mask, do hand hygiene, and most important, cough etiquette. All office staff are required with PPE supplies and provide face masks at entrances if patient does not have one, and provide masks in waiting room and patient check-ins. Staff continually manages patients and visitors' access to know where they sit and move around in the office, while training patients and visitors to the office hygiene protocol. If a patient is confirmed to have a virus or possibly have the virus, they should be immediately screened for respiratory symptoms and informed of proper hygiene procedures. Again, a patient should be directed to a local emergency room. Exposed visitors should report any signs or symptoms of acute illness up to 14 days after the visit. Our staff monitors and manages ill and exposed healthcare personnel. We notify public health officials of any monitoring decisions if our personnel is exposed to the virus. Of course, our sick leave policies have been implemented if a staff member has been exposed to a patient with the virus, to conform with public health policy. Healthcare providers also have stress due to the impact of COVID-19.
Have the staff's stress level increased due to the COVID-19 virus?
Yes, the staff stress levels have increased at least threefold. There are surveys that can be used to track trends and stress levels, identify specific drivers of stress, and develop supportive infrastructures based on these drivers. The American Medical Association is offering 2 no-cost surveys to help healthcare organizations monitor the impact COVID-19 has on their workforce during this pandemic.
With the increased stress levels on medical staff, what resources are available to bring attention to the emotional and mental well-being of staff?
We schedule staff meetings to discuss potential issues and present resourceful information from, for example, Headspace is a mediation and sleep app that can help positive impact on health professionals' personal and professional lives. Organizations like Mount Sinai and UNC provide online toolkits where all well-being resources are centralized and easy for clinicians to access. Contract with therapists to provide easy access for staff, which includes emotional support for family members of clinicians as well. Keep a supply of basic well-being needs, food, drinks, hygiene items in the office for staff. Create social support. We have staff meetings to discuss any problems or concerns on a weekly basis.
Can an independent medical practice survive COVID-19 during these unfamiliar times as we move into the future?
Yes, creating workload redistribution, we have realigned our staff, such as physicians, ARMPs, PAs, who are at home, on quarantine, or for children care. Manage the inboxes and phone calls of those who are at work and provide telemedicine care. Most medical practices have shifted their model to incorporate telephonic and telemedicine, home visits for seniors, and office visits. Patients appreciate telemedicine visits because they feel more secure not leaving their home to minimize the chance of exposure to COVID-19.
Thank you, Joseph, so much for joining us this morning to share CDC protocols and procedures healthcare providers should follow to prevent exposure to COVID-19.
Thank you, Rosalie, for having me. It's been a pleasure.
Roger McNamee is a well-known Silicon Valley investor. Roger mentored many tech leaders during his celebrated career as an investor. But few things had made him prouder and financially more successful than his early service as a mentor to Mark Zuckerberg. Roger never thought, as an early investor and large shareholder in Facebook, he would devote himself to stopping Facebook from destroying our democracy. But now he's become a key activist working against the existential threat the tech giant could pose to our health and political order. He's also the author of the New York Times bestseller, Zucked, Waking Up to the Facebook Catastrophe. Roger joins us this morning to share Facebook's catastrophic failures due to some very bad actors and tech leaders unwilling to share their concerns. Good morning, Roger.
Rosalie, it's really good to be here. Thanks for having me.
You know, Roger, I love people that get into tricky situations, but you know the tech industry and corporate governance. Why did you decide to write this book and raise awareness about the existential threat of Facebook and educate the public to what's going on behind the scenes?
So, Rosalie, it never occurred to me during the 34 years that I was a technology investor in Silicon Valley that I would ever need to become an activist, much less that I would become one. What happened was early in 2016, I started to see things on Facebook that really scared me, things I never would have expected to see, where bad actors were harming innocent people in two areas: related to elections and democracy, both in the U.S., but especially in the United Kingdom when they had the Brexit referendum, and then also related to civil rights. So I reached out to Mark Zuckerberg and to also Sheryl Sandberg, whom I've also been very close to, in October of 2016 to warn them. And I spent 3 months pleading with my friends to do the right thing because I was convinced there was something really wrong, and they just dismissed it, and I realized I was faced with a choice. I could either sit back and let it be somebody else's problem, or I could recognize that I'd played a role in building this company and I had a duty to tell people what I knew, and I chose to do the latter.
Most people know who Mark Zuckerberg is, but not many people know who Sheryl Sandberg is.
So Sheryl Sandberg played an incredibly important role in my life. In 2000, I was helping my favorite rock and roll band, the Grateful Dead, do their digital strategy. And Bono, the lead singer of U2, was working with Sheryl. She was at the Treasury Department. She was the chief of staff to the Secretary of the Treasury. And she and Bono were working on a millennial debt forgiveness plan to save emerging countries that had too much debt. And Bono had heard about this thing I was doing with the Grateful Dead and wanted to meet me. And Sheryl said, I know who this guy is. My brother-in-law works for him. So she introduced me to Bono, who became my business partner. Then when she left the Clinton administration, she moved to Silicon Valley. She was looking for a job. I helped to introduce her to Google, which is where she went. And then after she helped to build the advertising business at Google, I then introduced her to Mark Zuckerberg and helped to bring her into Facebook. And she did an amazing job, but eventually the company became so successful, I think they just lost perspective, and power maybe has caused them to be less sensitive to the needs of the people who use their products than I wish they were.
Speaking of power, what do you think of social media platforms like Facebook allowing false political ads or controversial ads?
I'm really troubled by it because I think Facebook, it's a good business. It doesn't have to hurt people. It doesn't have to undermine democracy. And I don't understand why they're doing this, and I'm pleading with them. I think all of us as voters need to recognize that it's in our interest to treat these companies the way we treated chemical companies 50 years ago, when they used to pour waste products like mercury into fresh water, and we regulated them because we said chemicals are too important to the economy to be left doing damage. And I think technology is the same way. We just have to recognize that these guys are not going to behave responsibly on their own, so we have to force them to do it.
What type of data sharing did you find that was being sold, and how can the result of those who are selling our data undermine democracy, public health, and our individual rights of privacy?
Think about it this way, Rosalie. We think the deal is that we give up a little personal data for a service we really love. And if that's all that was going on, it would be fine. The problem is that we as human beings have no rights in the United States to the data about our lives. So when we use a credit card, when we travel, when we go and have a medical test, all of that data is available in a marketplace to be bought and sold. And companies like Google and Facebook have acquired all of this data. Essentially, every touch point we have, everywhere we go on the internet, every app we use, they get all that data. They create what's the equivalent of a data voodoo doll. And with that, they can both predict our behavior, and they can also use it to manipulate our behavior, because we go to Google and Facebook to get answers to questions we have, and what we don't realize is that the answers we get are being manipulated according to the ads that they've sold. And that's, in my opinion, just the wrong way to do these things. It's incredibly profitable, but it's just not fair.
When you speak of surveillance capitalism, is that sharing our data?
So think of surveillance capitalism as the accumulating of all the data. So the sharing is a core part of it, but it's this notion that data has replaced oil as the most important commodity in our economy, and that gives Google, Facebook, Amazon, and Microsoft huge advantages over every other industry. And every other industry is going to lose profitability to internet platforms the same way that the media industry already has. And that process has begun. You see it in financial services, you see it in healthcare, you see it in transportation. And my argument is that we need to have a national discussion about all of these things, about what kind of a country do we want to live in? What kind of economy do we want to live in? Do we want to live in one where everybody's driving for Uber because they have to have 3 jobs? Or do we want to live in one where people can earn a decent income, support a family, send their kids to college without being bankrupted?
What happened to making a living through the marketplace of ideas?
Exactly. And so my point is capitalism should be a really positive force in society. And right now it's broken and we need to fix it. But we can do that. We have the power. We have the numbers. And in my mind, my job on this whole thing as a lifelong capitalist is to show people a path for how we can do this in a way that serves the interests of everybody.
Roger, I'm sorry your friends in Silicon Valley feel you're a turncoat. Remember, no good deed goes unpunished.
Well, and the point is I have a lot of new friends, and my basic attitude, if somebody doesn't like what I'm doing, I understand, and they make their own choices. And I've met so many beautiful people like you on this journey, and I just, I'm very happy with the way things have turned out, and I feel like I'm doing the right thing, and as long as I'm doing the right thing, it'll all turn out just fine.
So where can we learn more about your book?
You can go to my website, which is zuckedbook.com, if you want to learn more. And I just want to thank you, Rosalie, for giving me a chance to talk about this, because it really is the issue of our time, and almost every issue in society that we're worried about is made harder to solve by internet platforms.
Roger, thank you so much for sharing the concerns in the lack of corporate governance and social media to protect public privacy.
It's been a great pleasure, Rosalie. Take care.
As a disability advocate since 1999, through Archer Disability Foundation, I have found great success in helping young individuals grow and mature through self-advocacy. One such person is Pat Robert Archer.
One of the largest minority populations in the world are people with disabilities. I was born premature to a teen mom with intellectual disabilities and various medical issues. In the late 70s, my mom and I moved from Michigan to join family in Palm Beach County, Florida. As a single mother, she worked with Palm Beach County Social Services to identify an educational program to address my disabilities. She tried 2 programs that failed, but continued her advocacy until she found a residential educational and behavioral program funded by United Way in Miami. At age 6, I entered the program as nonverbal. Then, with the help of teachers and speech therapists, I began to speak in sentences after 1 year at Montanari Clinical Studies. At 16 years old, I transitioned into Miami-Dade Public Schools program at Goodwill Industries. In 1992, Hurricane Andrew hit Miami and destroyed the Goodwill Industries building, and I was displaced. I graduated high school from Dade County School District with a special degree, meaning I would not meet requirements as a degree-seeking college student. In 1994, I entered the school district of Palm Beach for a GED night education class to work towards a GED to meet college entrance requirements. I was travel trained, so I knew how to use public transportation and my bike. 6 years later, I graduated with a GED and enrolled at Palm Beach State College while working at Publix. In 2006, I started volunteering with Archer Disability Foundation as a self-advocate. Soon after, I met a mentor who changed my life from Kennedy Space Center. Gabe, my mentor, offered me an opportunity to be mentored at Kennedy Space Center. I also like being a photographer, volunteer intern for high school disability mentoring programs. As a self-advocate, I participated in Disability Mentoring Day at Kennedy Space Center from 2007 to 2019. And in 2010, I was honored by Florida Governor Charlie Crist as a gubernatorial appointee to the Florida Development Disabilities Council. to represent South Florida. And in 2014, I was reappointed by Governor Rick Scott as a Florida Development Disabilities Council member. I worked tirelessly on the Transportation and Employment Task Force for over a decade statewide. In 2017, I graduated with an associate's degree in arts. After graduation, I explored the next step in higher education to attend Florida Atlantic University. I attained financial aid from Florida's Vocational Rehabilitation to work towards a bachelor's degree in the Multimedia Studies to work. In 2019, I was recognized at the Florida Atlantic University David campus for my transportation challenges. I was proud to be honored with the Broward Achievement Jeff Klein Accessibility Award. 2 weeks later at the Florida Atlantic University Boca Raton campus, I was a presenter at a special student accessibility luncheon. There I gave thanks to my special accessibility service counselors and praised the support services offered at FAU to advance my academic journey. In May of 2020, I completed my bachelor's in multimedia studies and look forward to the graduation ceremony when it's rescheduled due to COVID-19. I will continue my advocacy for persons with disabilities here in Florida. My most recent experience last November was very unique because I was offered an opportunity on Disability Mentoring Day at Kennedy Space Center's KSA-TV with my mentor, Daryl, to perform a live mock interview of an upcoming SpaceX launch. You are looking live at a Falcon 9 rocket on the launch pad at the Cape Canaveral Air Force Station in Florida. People with disabilities come from all socioeconomic levels, different races, gender, and religions with different ideologies. But one thing is in common: they want to live in a community that respects them so they may have opportunities to live, work, and enjoy the freedom that all people in our nation are afforded. May I take this opportunity to let Floridians know people with disabilities can overcome their challenges and grow in an all-inclusive community.
With the summer weather here, we should not let our guard down to protect ourselves and our family from spreading infectious disease. Staying safe includes keeping our information secured from online predators. We're all in this together, and it's vital for our culture to respect each other, to protect our health and mental well-being. As we embrace all people in our community, we will build together a strong and diverse workforce based on opportunity and innovations that will benefit all for the greater good. Share with us how you protect your community to benefit all at facebook.com/Rose Lee Show, and follow us on Instagram at The Rose Lee Show, and watch this episode and many others 24/7 at RoseleeArcherShow.com. Thanks so much for joining us this morning, and we look forward to seeing you soon. The proceeding was a presentation for The Rose Lee Show. The views and opinions expressed in this program are not necessarily those of this station.